starting a career in healthcare. So you have to start with a foundation. You have to know where you want to be. So if you want to be a nurse, you think long term. So you want to be a nurse, you start off at your Baltimore community colleges or your community college, whatever city or state that you're in. You start there and you become an LPN first, and you get the certificate, or you become which LPN is licensed practical nurse. Once you become that, you can now have a career in the healthcare field where now you can work, get a job in a hospital, and now they can assist you with paying for becoming an RN, a registered nurse. So you have to follow those steps. If you don't want to become a licensed practical nurse, you do another trade, which is in the community college, which is phlebotomy, where you're just taking blood, but you're also in the healthcare system. You get into the hospital, you get into these community centers, which gives you the benefits to allow you to pay for further education. So you want to start small and build on that. If you have plenty of time to do it, and then that way, because you're young and you have the ability to do it, is great. Also, because you have a job, you can do this while you're working. So you can work during the day, go to school at night, you can have classes online. It's great for you, so you have the best of both worlds. You're getting your education, going to the school that you want to go to, and getting at the ultimate career that you really want to have.
So how much can a licensed nurse make?
A licensed practical nurse, the median income for them is about $50,000 a year for a licensed practical nurse.
And a registered
A
nurse?
registered nurse, the median income for them is about $75,000 to $80,000 a year.
Okay.
And then the next step after, if you want to go further, after becoming an RN, you want to get a master's degree, you become a nurse practitioner. Nurse practitioners are allowed to write a script just like a doctor is. So now you're walking around with a stethoscope, and you'll be able to see patients just like your doctors.
Okay. So can you tell me a little bit more about the phlebotomist? And I'm not familiar with that. What is that?
The phlebotomist is the ones that when you go into your doctor's office and you have to take labs, they're the ones that's in that lab, that section that's taking your blood. That's what the phlebotomists do. They're also in the hospitals. They come to your room. They're taking your blood. They are the phlebotomists.
So do they also work at places like LabCorp?
They work for LabCorp. They work for Quest Diagnostics. They work for hospitals. They work for health centers. They work everywhere. They're everywhere.
Okay. What exactly can you tell me what you did at the hospital where you worked?
Well, what I do is I'm called an insurance specialist. So what I do is I assist families navigate their health plans. So insurance companies do not like to pay for health care at all. So I help them walk them through the entire process. So I can go through or read your medical policy bulletin and let you understand, yes, your insurance company said, no, we're not going to pay for that. Well, yes, you are, because of clinical policy bulletin P24. And it states you do this because of this.
So basically you're really good at reading insurance policies,
right,
and figuring out what
your insurance, get the best out of your insurance, the most out of your insurance.
So you squeeze the most value out of every insurance policy.
Exactly.